nation's opioid epidemic has never been deadlier.
We have a 20% dropout rate. It's one of the highest in the developed world.
90% breathes unsafe air.
More than 42 million people in the U.S. go to bed hungry each
Gun
night.
accidents killed at least one child in the United States every other day.
Surge in COVID cases here in the U.S.
Hospitals are in crisis.
Is dealing with the worst pandemic in a century.
Devastating decline in the mental health of kids.
Now more Americans dead than in 4 years of battle during World War II.
Welcome and greetings from Baltimore, Maryland and the Johns Hopkins Bloomberg School of Public Health. My name is Shane Bryan and I'm the Partnership and Engagement Officer with the Bloomberg American Health Initiative.
And I'm Faria Zaman, Fellowship Officer for the initiative.
Hi everyone, my name is Scarlett Sagasume. I'm the Fellowship Coordinator here at the initiative.
All right, y'all, we're really excited that you've joined us today. You're going to have an opportunity to learn a little bit more about the Bloomberg American Health Initiative, and more specifically about the Bloomberg Fellows Program. So we're going to do a little bit of talking and sharing with you all at first, and then we have a lot of time built in to answer your questions. So there'll be an opportunity for you to join us, come off camera and unmute to ask your questions, and we'll let you know when that time happens. But let's go ahead and get started with our presentation. So at the Bloomberg American Health Initiative, we got started in this work back in 2016, which was the centennial year at the school. And all of our work falls within 5 focus areas: addiction and overdose, violence, food systems for health, environmental challenges, and adolescent health. Now, for our fellows, when they apply into the program, they would select one of the 5 focus areas, which would dictate a series of courses, who their faculty advisor is, connection to their peers, and such. Now we're going to go over and dive a little bit deeper into each of these 5 areas, and you're going to get a chance to hear from each of our fellows, or one fellow actually, from each of the focus areas. Let's go ahead and start with the addiction and overdose focus area. So here we're focusing on the opioid epidemic. We want to start breaking down those stigmas and the discrimination that we see in various public policies. And I want to turn it over to Krister Moynihan, who is going to be able to share with you all a little bit more about their work in this focus area.
My name is Krister Moynihan, and I'm the Chief Program Officer for Rebel Recovery, located in Palm Beach County, Florida. The addiction and overdose crisis is complex and must include community-driven, multifaceted solutions. The Bloomberg School of Public Health has propelled my work in this area as a public health professional and supported the growth and impact of my organization.
Now for the next focus area, we have violence. And certainly we're looking at the interpersonal violence that happens within community, but even more so, we focus on community violence, suicide, intimate partner violence, and we have fellows and organizations that work in all of these spaces. We also have folks who come from a variety of backgrounds and lived experiences. We have folks working for community-based grassroots organizations and folks who work in law enforcement. The next fellow I'd like to introduce you to who can share a little bit more about their experience is Michael Cunningham.
My name is Malcolm Cunningham. I am the Health Outcomes Manager for ProMedica's eBuy Neighborhood Promise that works to address the social determinants of health. So while still relatively early in the Bloomberg Fellowship, the depth of knowledge, the perspectives of practitioners, of students, of professors from across the country has just been stunning. And I'm looking forward to continuing to deepen my knowledge, my understanding of public health, and applying it in the context of Toledo.
Now for Food Systems for Health, we're taking a more systems-based approach. Folks might have access to great grocery stores that they can walk to in their local community. Others, access to nutrition might be the local corner store. So what are we doing as a society to ensure that we are making sure that the produce is getting to the households or to the schools? And so for the Food Systems for Health, we have folks who work in the agricultural space, the planning space, thinking about marketing and how we're marketing healthy foods to individuals. And the fellow that I'd like to introduce to you next is Danielle Nabeck, and here she is.
I'm Danielle Nabeck, and I'm a Healthy Communities Coordinator for the University of Wisconsin Extension FoodWise program. In my role, I'm focused on policy systems and environmental change efforts that support community food and health systems here in Milwaukee and across Wisconsin. In addition, the multidisciplinary nature of the Bloomberg Fellowship aligns with Extension's priority to bridge disciplines to inform our most pressing societal problems and create community change across Wisconsin.
All right, next we have environmental challenges. So, we're certainly looking at air quality and climate change, but even more so, thinking about how a community's built environment is affecting the lives of those who live there. We take another system-wide approach using this cross-sectional opportunity, connecting with folks who are in urban planning or working in city government. How can we ensure that folks have access to safe and healthy streets? And for one of our fellows who's doing this great work, I'm going to turn it over to Michelle Mabson.
My name is Michelle Mabson, and I'm a staff scientist in healthy communities at Earth Justice. I work to hold polluters and the government accountable so that communities do not face undue harm from air and water pollution or exposure to toxic chemicals or waste. As a Bloomberg Fellow, I have the incredible opportunity to collaborate with other fellows and their organizations, professors, and staff to address the environmental challenges that affect the communities that I work with.
All right, and for our final focus area, we have adolescent health. In this particular focus area, it's our only population-based focus area. We're looking to connect and engage with opportunity youth, those individuals who are between the ages of 16 and 24. We have a number of folks who work in community-based organizations. We have folks in schools. The fellow you're going to get to hear from is actually a community librarian. Her name is Emily Witkowski.
My name is Emily Witkowski, and I am the teen librarian at the Maplewood Memorial Library in Maplewood, New Jersey. I think being a Bloomberg Fellow has enhanced my work at the library tremendously. For example, when the high school community experienced a tragic loss, I was able to provide social and emotional learning resources to the administrators and counselors at the school, and I found those resources through my coursework and research at Hopkins.
All right, y'all. So those were our 5 focus areas. Make sure you took notes. We're going to have a quiz at the end of the presentation. Kidding, of course. So next we have our 3 cross-cutting themes of equity, evidence, and policy. And we integrate this into all the work that we do here at the initiative. For equity, we want to ensure that we're connecting and engaging in communities all across the country, urban, suburban, rural, tribal, and the U.S. territories. We also want to ensure for the Bloomberg Fellows Program that we're bringing in folks from a variety of background and lived experiences. Evidence is all about the data. We want to ensure that we're collecting and bringing together strong data sets that inform our practice and our policies. And for policy, we certainly are looking at the national, state, and local level policies, but also for our collaborating organization and partners, we want to work with them to ensure that their policies affect the way that their employees engage and connect in community. Now, we have 3 approaches here at the Bloomberg American Health Initiative: research, practice, and education. For the purpose of today's conversation, we're going to focus on the educational approach, and that's where the Bloomberg Fellows Program lives. Now I'm going to turn it over to Faria to tell you all a little bit more about the fellowship program.
Thank you, Shane. So good afternoon, everyone, and I'm excited to tell you about the Bloomberg Fellows Program. It's a very unique program and different from your typical scholarship program in that it is impact-based. And so we are looking for individuals who are already working on the front lines across the country in any one of these 5 focus areas. And the education that you receive, your public health training, is aligned with your focus area so that you can apply those skills in your actual work and your organizations can benefit from it as well. Another unique aspect of the fellowship program is what we call the service obligation. So that is a 1-year commitment that all fellows must make to continue working with their collaborating organization following graduation for at least a year. And we require this from our fellows so that the organizations can also benefit from your public health training. And what we're trying to build here is a vast network of practice among our fellows and our organizations across the country. And I'm going to hand it over to you, Shane, so you can elaborate on the network of practice.
Thanks, Faria. Yeah, so as Faria mentioned, we have organizations and individuals from all across the country who are doing great work in these 5 focus areas. And we call this our national network of practice. So beyond the fellows, the organization, we also have faculty and thought leaders who are leading really important work to improve the lives of those in their neighborhoods. So we're looking for all types of organizations, both traditional, folks who might work in a medical or a public health space, but even more so, and something we get really excited about, are those of you who work in what we call our non-traditional public health organizations. This might be a grassroots violence prevention organization. It could be an urban planning corporation or firm. We're just really excited to be able to take and use the lens of public health to widen and deepen your impact in your community. Now, there's a number of ways that we engage and connect with the community, and one we want to share with you all is our annual convening that we call the Bloomberg American Health Summit. We bring all the stakeholders together for a couple of really high energy, high impact days to provide individuals with kind of where we are at currently in these 5 areas and give folks the motivation to go back into their home communities and continue doing the great work that's improving health outcomes. Now, as you can see, we really are valuing this dialectical and mutually beneficial relationship, not just between the fellows and the school, but also ensuring that the organization's involved. And there's a number of ways that we get organizations and other staff members involved here at the Bloomberg American Health Initiative and the Bloomberg School of Public Health. Now let's talk a little bit more about the difference between the full-time and the part-time program. Scarlett, would you mind?
Yeah, thanks, Shane. So we have a full-time and a part-time option. For the full-time option, the courses are taken in Baltimore in person at the school, and this is completed within 11 months, and fellows take this option. They're given 5 8-week courses, 8-week terms from June until May. So that's where the 11 months come in. And the part-time option, this gives folks a lot more flexibility. Fellows take classes online from anywhere in the country. We even have some fellows in Alaska. The degree is completed within 2 to 3 years, though we do allow up to 4 years. And fellows take 1 to 3 courses per term, and each term is 8 weeks long.
All right, so Faria, I think folks are already ready to apply. They want to know what's their next step, how they can prepare. Do you want to tell them a little bit more about the application process?
Absolutely, I sure do, Shane. So it's quite a simple process. Basically, there are 2 steps. First, you would apply to the MPH program, and to do that, you'll need to go to their website and read about all of their admissions requirements, and your application would be submitted through SOFAS, and SOFAS is the name of the application processing system that the Bloomberg School uses to collect applications. And so that means your transcripts, your letters of recommendation, and everything else for the MPH program application is submitted through SOFAS. And I always tell folks to start the process early because it takes some time to gather all of your documents for the MPH application. The second part is to actually apply to the fellowship, and that's pretty easy. On our website, you will find very specific details and instructions on how to apply to the fellowship. We use an application platform called Submittable. And when you're on our website, it will lead you to the Submittable platform where you will create your account and you will have access to the fellowship application form, which is pretty brief. You have a few essay questions for the applicant, and then there is a second portion of that form that is for your collaborating organization to complete. Now, our application cycle opens every year on August 1st, and the deadline every year is December 1st. And I always tell people, please don't wait till December 1st to submit your application. Always plan early, start early, and try to submit your application as early as you can. And if you have any questions during the application process, you will get our contact information at the end of this webinar. You are more than welcome to reach out to us anytime.
Great. Thanks, Faria. Now, there's a number of different ways that you all can stay connected and involved with what we're doing here at the initiative. And I think, Scarlett, you'd like to tell us a little bit more about ways folks can do just that.
Of course. So our website, of course, has a ton of resources available. Our FAQs are there, which we encourage you all to read. You can also find our fellows and alumni on there and see what they're up to. We have a newsletter called the American Health Dispatch, which you all can subscribe to. Our YouTube also has lots of videos, including our most recent summit. And we're really active on Twitter, so please give us a follow at American Health.
All right. Well, folks, that is our formal presentation for you. Now what we're going to do is we're going to invite you all to join in on the conversation. So go ahead, we're going to start bringing everyone into the Zoom room, into our virtual meeting room, if you will. And there's going to be opportunities for you all to raise your hand, so use the raised hand function, and you'll be able to ask the questions that you have. And so again, they're going to start bringing you into the room. If you have a question, use the raised hand function. You will then be highlighted, and you must unmute yourself and turn your camera on yourself in order to join the conversation. So as we're bringing you all into the room, I'm just going to start off with a couple of questions that we had emailed in prior to the recording of this webinar. So far, maybe we'll start off with a question I think we actually get quite frequently is, do folks need to take the GRE in order to be admitted or selected as a Bloomberg Fellow?
So that's a great question, Shane. The MPH program recently stopped requiring the GRE. So if you don't want to take the GRE, you no longer have to apply to the MPH program. However, if you would like to submit your GRE score, you're more than welcome to do that.
Great. That sounds good. And so I am not seeing any. I'm sure there are really great questions coming in. We're going to go with one more that we had emailed to us. And this one in particular is about prerequisites. So are there any prerequisites folks need to be concerned about as they're applying into the program?
So that's a great question, Shane. And the MPH program does have some prerequisites, for example, in math and biology. And so when you submit your application, you should also reach out. If you don't have recent courses in biology and math, you should reach out to the MPH admissions office, and they will be able to advise you on whether you would need to take a course in biology or in math.
Great. The next question that we have here is from Aaron. Aaron, if you're able to turn your camera on and ask your question, unmute, we'd love to open the floor for you. Not yet? All right, so we're going to come back to Aaron. At least we're not hearing it here in the studio. There's Aaron. Hey, Aaron, how are you?
Sorry about that. I was rejoining. I'm doing well. How are you all?
Good, good. So we would love to open the floor to your question.
Yeah, thank you. Well, I at least want to say thank you for hosting this. It's extremely helpful, extremely informative. So I appreciate it. And so the question I had, because of course with the Bloomberg American Health Initiative Fellowship, there's also a fellowship for DrPH applicants, right, in addition to MPH applicants. And so I was just wondering, is the focus, because I know that we kind of talked about practice, research, kind of the different sort of components or aspects, is there a particular leaning towards research or practice in terms of qualified candidates for the fellowship? Because I know it's kind of, with the public health programs, it tends to be a mix, with the DrPH leaning a little more towards practice. So I thought I would just throw that out there as a question.
Okay, I'm happy to take that question, Erin. So the DrPH program, it is more of a practice focused degree. And so I think if you're interested in learning more about what their preferences are, it would be best to reach out to them directly, and we can provide you with a direct contact for the DrPH program. But on the fellowship side, what we're looking for are people who have a great track record in their selected focus area, and whether they're in the community, whether they are doing research, or whether they are a social worker or teaching, or they're at a public health department, as long as they are showing a track record of accomplishments in their focus area and really showing a demonstrated commitment that this is something that they're serious about and they want to pursue it, and they want to continue pursuing this after receiving their training, whether it's in the DrPH program or the MPH program. And another thing we look for, Aaron, is the organizations and the strength of their support for the applicant. So that's really important, that the organization strongly supports the applicant and is sincerely interested in being part of this great initiative.
Excellent. Thank you so much.
Of course.
Thank you for your question, Aaron. And so just as a reminder to folks who are in the space with us, if you have a question, if you use the raised hand feature of Zoom, we'll be able to come to you and you can ask your question. We'll address it live here for you. So until we get the next one, Faria, we have another one that was emailed in ahead of the webinar. And it's more so about how often or required are fellows to come in person, to be physically present, if you will, in Baltimore for the fellowship program?
Okay, that's a great question, and one that we often get. So as a Bloomberg Fellow, whether you're doing the program part-time or full-time, all fellows have to do a certain number of in-person credits. And those credits can be taken anytime during the year, whenever it's convenient for the fellow. And most of our fellows take these courses, as you know, during the summertime. So people tend to have more flexibility during the summer. And so that's one aspect of fellows being in person, to take these courses, to be able to interact with us, with each other, and the faculty. We also have a fellowship orientation. And that is typically held in mid-June during the same week that the MPH orientation is held. And so in the past, that was in person. And then, of course, during the pandemic, we went to Zoom. And then we had continued the Zoom orientation. Now this year, I'm not sure yet if it will be held in person or possibly hybrid, but that's another area where we expect our fellows to attend. And then, of course, we have our annual summit.
Oh, yes.
Our annual summit is held at the end of each year, and all Bloomberg Fellows are required to attend that.
All right, great. And something I think to go on that's connected to this is folks, different organizations have different requirements for individuals taking leave. Some organizations will expect a fellow to use leave time or PTO. Other organizations are more flexible. It's just really up to the organization.
Yes, it very much is up to the organization and the fellow to work that out.
All right, so we have a couple of questions that have come in. I think our next question is from, is it Tapia?
Tapia.
Tapia, nice to meet you. What's your question?
Oh, thank you. My question is to do with the collaborating organization or organizations. Do you have a particular size for such organizations to be eligible to for the Bloomberg American Health Initiative? Because I was just reading on the website and I see that a lot of them, they seem to be really experienced organizations, really big. And I was just wondering, in our case, we're interested, but we're a much smaller and non-traditional public health organization, so to speak, although we do public health work at the level of the community. I mean, would we be eligible? Is there like a set size to be eligible to be a collaborating organization? Thank you.
Great question. Great question. And no, there isn't. There's no set size. We're really excited that your organization is a non-traditional organization that's doing great, probably really amazing public health work. But we have organizations that have very small staffs, just a couple of folks, to very, very large for-profit corporations or the federal government agencies. So no size requirement, right, Faria?
No, that's absolutely right, Shane. There is no size requirement. Really, the only requirement that we have for collaborating organizations is they're supportive of the selected fellow, and they are based in the U.S. and working in one of the 5 focus areas. And so it can be any organization as long as it meets those requirements. And like Shane said, we have small community-based organizations, and we have large federal agencies, and we've got everything in between. So it's pretty wide open.
Okay, thank you.
Of course. Thank you for your question. All right, next I think we have up there Kelly. Hey, Kelly, what question do we have?
Hi, good afternoon to you all. I am interested in the part-time fellowship program, and I'm really curious about what the weekly coursework kind of looks like. Want to make sure I balance my full-time job with being able to be a good student, of course.
Faria, you want to take that one?
Yeah, I'm happy to take your question. So in terms of part-time studies in the MPH program, it is quite flexible. The degree can be completed anywhere between 2 to 4 years. You have a maximum of 4 years, but our students tend to finish up in about 3.5 years. And in terms of the course load, that's really up to the student. You get a lot of guidance and advisement from your academic advisor as well as the MPH program in terms of how many courses are manageable on a part-time basis. And so there's a lot of flexibility, and it's really up to the student to decide what would work best. I don't believe the MPH program has like a certain number of credits that you have to take, every term. It is pretty flexible. But as a Bloomberg Fellow, as I mentioned earlier, you are required to take a certain number of credits in person. And like I said, this is pretty flexible too. Most of our fellows take care of this requirement during the summers, and you can spread it out for the entire duration of your studies. So I hope that helps answer your question.
Thank you so much. All right, so we have some really great questions coming in. Kelly, great one there. Next, we have Andrea. Andrea, thank you so much for joining us. And what question do you have for us?
Hi, I just have a mini question, another question. For the mini question is for the DrPH, if the year requirement was the same as for the MPH, the 4-year. And I also wondered, I'm wondering if, like, looking at the environmental kind of sector, I work in infectious disease, and I'm wondering how the panel would, it seems kind of non-traditional to look at, but looking at infectious disease as relates to indoor air quality and climate change.
All right. So for the starting with the first question, that it isn't the 4 years. We will say that. So how long do those DrPHers have to finish, Faria?
Well, it's quite generous, Shane. So the DrPH students have a maximum of 9 years to complete the DrPH degree, so very generous. And it's also very flexible. It's part-time as well. And as a fellow in the DrPH program, you do have a certain number of the in-person credits to complete. But yes, 9 years to complete the degree. And for the second part of your question, I mean, I think that sounds fantastic, and that would absolutely be in alignment with the fellowship program. Each of our focus areas are really broad, right, Shane?
They very are.
And I think in particular, the environmental challenges focus area is extremely broad, and I think the work that you are doing would fit very nicely.
Yeah, and we actually have some faculty members who do a lot of work with air quality here that are affiliated with the initiative. So I think even connecting with them is a good idea, just to see how that might align nicely to the DrPH program and to the fellowship. But that's another thing for all of you who are tuning in and listening, as you're considering not just the Bloomberg Fellows program, but the Johns Hopkins Bloomberg School of Public Health. Think about the faculty and who these individuals are that you might be wanting to drop an email to and just set up a time to chat with them as well. That's always an opportunity for you.
And thanks for bringing that up. That's a great idea. All of our faculty are listed on our website, and their research areas are there in their profiles, and also their emails. And so you can feel free to reach out directly to any faculty you like to ask questions.
Yep. And we're here to help if you need any help connecting with them as well. All right. So, Andrea, hopefully we got that question answered for you. Thank you so much for asking. Wonderful. All right. Next, we have Mary. Mary, thank you so much. What's your question?
Hi there. I was wondering if you had any kind of requirements for geography. I noticed in your intro so I'm in Milwaukee and you have a fellow in Milwaukee. So I'm curious if you try not to duplicate the same geographies or, just about that, if that's taken into consideration. Thank you.
That's a really interesting question, and I think it might be the first time we've gotten that particular question. But no, no, we want folks to be applying from all over the country, and certainly, Milwaukee would be fantastic, but really anywhere. It's just the only requirements that it's U.S. based. You're here, and the United States are one of the U.S. territories, but we don't take into consideration how many we have from any particular area. But we're particularly, I will say, interested in engaging and connecting with more folks from Middle America, as we don't have a ton of representation currently in that part of the country. But yeah.
Okay, thank you.
You're very welcome. All right, so next we have Julie. I think you're our next on our list. Julie, what question do you have for us?
Sure. Hopefully it's a pretty simple question. You were talking about those required classes for the part-timers who would be coming into Baltimore for that, maybe are not local to the area. What kind of housing resources would there be, assuming that would be a very short term that you would be there?
I'm happy to answer that question for you. So with the in-person credits, a lot of our fellows reach out to each other and try to coordinate and find out what other fellows are going to be here on campus during certain times, especially during the summer institutes. And they all sort of coordinate. And in the past, we've had fellows who found housing together. And also the MPH program has resources on housing in and around campus. So that's also another place where you can draw on resources and get advice. Our fellows have a platform called Slack that we use, and so all the fellows, the faculty, the initiative team, everybody's connected on Slack. So if a fellow has a question or wanting to know, hey, I'm coming in June to take these summer courses. Anybody else coming? Do you want to share housing? You put that on Slack and you will guarantee get responses. So, there's help out here and there's resources. And it really has to do with just coordinating and communicating. And of course, the initiative team is helped to facilitate in any way.
Yeah.
Great, thank you.
Great, thanks. So next we have Radka.
Hi, nice to meet you. Thank you so much for this opportunity. My question is around the requirements for the partner organization. how long do you have to be affiliated and or working for the partner organization to be qualified to apply?
A really great question, Radka. So we don't, it's, nothing, no term, no amount of time is required necessarily. But as far as I can maybe speak to a little bit more, part of the form for the fellowship application is a member or representative of that organization being able to speak to your abilities and the work that you do at that organization. But for the fellowship program, we don't really have a term or a number of months or anything like that. Before, do you want to elaborate at all?
No, Shane, we don't have like a set number of months or years that you have to be working with your organization, but we do want to see in your application strong support from your organization, and it should be completed by someone who really knows your work well and can talk about your potential, your accomplishments, and what they envision you doing once you receive this public health training, and how that will impact the work that you're doing for your organization.
It might be a good, great question, Rekha. It might be a good opportunity or time just to remind folks that the MPH program has a requirement that the folks need to be working, is it for 2 years?
At least 2 years after completing their bachelor's degree.
Yeah.
That is a requirement of the MPH program.
Are there any requirements for the DrPH program?
Yes, there are many. And so
the partner organization.
it applies to both the MPH and the DrPH on the fellowship side. The organization should be based in the US and should be working in at least one of the 5 focus areas.
Thank you.
Of course.
Thanks, Rekha. Great question. Chelsea, you're next.
Hi, everyone. Thanks again for hosting this little webinar. So my question is, well, let me give you guys a little bit of background. So I currently work for CDC under their Global Tobacco Control Branch. And I know that that probably falls more so into like addiction and overdose, and maybe even adolescent health, because we do focus some of our survey data for youth individuals. However, whenever I was looking at the different focus areas, the obesity and the food system really caught my eye, because I don't know if there's a way for me to apply my experience in that particular sector, maybe looking at like cigarette smoking and like suppression of appetite. Would that be like a stretch, or would it just be more so falling underneath the like addiction and overdose?
That's an interesting question, and I think it's difficult for us to say because we're not, we don't have a full picture of the work that you're doing, but it's really up to the applicant to decide which focus area best represents their interests and what they want to pursue. And so, a lot of our fellows, they may be in addiction, but it may be working, on adolescent health or even violence. So I think to have a really strong application, you would really need to make a good, strong case for whatever focus area that you select, and talk about the kind of impact that you've had so far and what kind of impact you want to make after receiving your public health training. And also showing, a track record of what you've been doing. If you've worked a lot in addiction and it touches very much on adolescent health, perhaps adolescent health would be your selected focus area. It's really up to you to decide what would make the strongest case, and also what you feel passionate about. Are you most passionate about adolescence or about addiction issues? And, that all should come through on your application, and your organization should also make a strong case for that as well. I hope that helps.
That did. One follow-up question, as far as like applying for the focus area. So once I kind of decide, is it possible to apply to multiple focus areas, or do you have to stay on one?
You do have to select one. And if you're selected as a fellow, that would be the focus area that you would pursue in the program.
I gotcha. Thank you so much. That was very helpful.
Great question. So just really quickly, there's flexibility in the courses that you would take. So you could, if you're doing adolescent health, for instance, you could certainly take some courses that are more aligned to the addiction and overdose focus area, because all the courses theoretically are public health courses. So you'll have electives that you can fill in here and there.
Yeah, and thank you for bringing that up, Shane. And the MPH program actually has a very generous selection of electives, and you can take any courses you like under the electives.
All right, so we have time for 2 more really good questions. No pressure, though. Amanda, we're up next with you. What question do you have for us?
Hey there. Thank you so much for hosting this today. My question is very similar to Chelsea's. I currently work in, I would say, one area of public health, but my passion is really in adolescent health. I've done volunteer work in that over the last several years. Are we able to apply for that other area that we're extremely passionate about while we're working in a different area?
That is an interesting question. So we are looking for people who can show a track record in their selected focus area. So for example, if you chose adolescent health, we'd want to see the work that you've been doing, your experience around adolescent health. And why you want to pursue it, how you're going to be able to make a change and impact in the future getting public health training with the focus on adolescent health.
Yeah, and similarly to what we shared with Chelsea is you have those electives. You can certainly use the electives and also build upon the network that you're getting and being a Bloomberg Fellow. Just hundreds now really of fellows and organizations across the country that you'll be able to tap into. But yeah, definitely you'll let us know which focus area is going to be the best for you in the application. So hopefully that's helpful, Amanda.
Thanks.
Thank you. All right, our last question of the webinar is going to go to Montana. Nice to meet you.
Hi, nice to meet you all too. Thank you so much for having this webinar. I had 2 questions. I was wondering, I'm currently a researcher with the University of Minnesota School of Nursing. I did not know if another university could qualify as a collaborating organization or if there's any conflict of interest, but I was also curious if you can transfer from the online program into the in-person program halfway through.
I'm happy to take that, Shane. So your first question, asking whether an academic institution would be an acceptable collaborating organization, and yes, it would be. We have several collaborating organizations that are academic institutions, so that would not be a problem. And the second part of your question was about transferring from another school into the MPH program. Is that right?
I think more so about if you're starting as a part-time fellow, can you then switch to be a full-time fellow?
Okay. Well, that would depend on MPH policy. And so if the MPH program allows a part-time student to then go into full-time, I don't think on the fellowship side we would have an issue with it, but it's very much dependent on what the MPH policy is changing tracks.
Yeah, and it might be it's good. It might be a good opportunity to reach directly out to the MPH program. And one thing just to note is the MPH full-time program really only starts in the summertime, so it might be difficult. I'm not sure if it's an opportunity or not, but they only have the full-timers start once a year, so that might also change things a little bit.
Yeah, I would suggest that you reach out to the MPH program directly and ask them about their policy on that.
Great, thank you so much.
Thank you. Great questions. And it's been really wonderful connecting and engaging with all of you today. I know we weren't able to get to all of the questions, but we would invite you all to send us any questions that you have. You can send those to Bloomberg Fellows, mph@jhu.edu. You'll see that at the bottom of your screen, hopefully right now. But you can send any remaining questions that you have to us, and one of us will be able to get back to you. We are excited to start getting your application starting August the 1st. Keep an eye out on our website. But in the meantime, let us know if you have any questions. We're happy to connect and engage, and have a wonderful rest of your day. Thank you so much.
Thank you.